is really sort of the packaged managed ACO population management care, right, from you can say cradle to grave, or as in the military, and then in the veteran service, whatever. So I do believe in the model of managed care, population management. As they say, Kaiser does it well. I think that we're going to see, I look forward to it. I think that everybody would do well in a population type managed care environment where the incentives are aligned to make people healthy. So there's not an incentive to see people more or to not see them. The incentive is to give them the best care in the right environment for the right price. I think that, you talk about the edges, and I'll just, you're right. I mean, the edges, and especially with kids, it's horrible. But I have to say that, our entire system is all about the edges. And what happens is we get the center wrong a lot.
Right. Yeah.
That's a great point.
We get this. We get the center wrong 50% of the time, and we're all talking about the edges. Yeah, we could have saved that one kid that had a really unusual disease. Let's get the center right. I actually read a very interesting article yesterday from a large university talking about shortening the length of time of medical training. For a long time we've thought that you have to be in residency for 4 years and do 3 years of research and all that other stuff, and that's all about the edges. But really what we need to do is to lower the cost of care and have enough care for everyone and have everybody out there. We need to sort of shorten the cost of medical education, and do all those other things and really begin to talk about the center. If we could get the center right, I'd feel really good. Now, I'm not saying that Kaiser always gets the center right, but I think, and
Peter.
Yeah, just.
Well, I was standing up for you.
Just real quickly, I would say that at Cigna, we use the term collaborative accountable care to describe what the government is calling an ACO, primarily focused towards Medicare patients. The ACO through ACA is targeted in the Medicare population. In the commercial population, we define it as a collaborative accountable care. And to me, that really means about aligning incentives between the health plan, the providers, and the patient to ensure that high quality care, cost improvement is in vogue, and that patient satisfaction is all part of that. So we're going to talk about where we see the future going. I think this is the greatest opportunity to take cost out of the system by defining what's the best setting of care and where we can improve cost through collaboration and not through battling over contracts.
Well, that tees up our last
Oh, wait
topic.
a minute. Now, the original
Tom.
Accountable Care Organization.
Sorry, didn't mean to cut you out, Tom.
Yeah.
He was so above it all.
I was just letting you describe us for me, so I didn't have to say, I won't repeat everything. But, we are, from the very beginning, the original Accountable Care Organization. The collaboration, the incentives, and physician-led. I mean, all of those things that are absolutely critical in creating an environment where you are working on the middle. I couldn't agree with you more. If you solve to the fringe and you give up the middle, everybody's going to end up at the fringe at some point. You can't afford that. And these investments in, for example, 70 to 80% of the chronic conditions that we spend billions and billions and billions of dollars as a care delivery system in America, 70 to 80%